Welcome back. The last part of my seminar, I will discuss the treatment of bad breath. Treatment of halitosis. The treatment for halitosis in the dental practice, firstly, have been categorized into 5 classes in order to avoid the mismanagement of the psychosomatic halitosis. These classes include treatment need 1, explanation of halitosis and instruction for oral hygiene, support and reinforcement of the patient's own self-care for further improvement of their oral hygiene. Treatment need 2, oral prophylaxis, provisional cleaning and treatment for oral disease, especially periodontal disease. Treatment need 3, referral to the physician or medical specialist. Treatment need 4, explanation of examination data, further provisional instruction, education, and reassurance. And last, treatment need 5, which is referral to the clinician or psychological specialist. As I said before, genuine halitosis subdivided into physiological and pathological. Physiological halitosis are being treated by treatment need 1, while the intraoral pathological halitosis treated by treatment need 1 and 2. Extraoral pathological halitosis according to treatment need 1 and 3. Pseudohalitosis treated according to treatment need 1 and 4, while halitophobia treated according to treatment need 1 and 5. Recently, as many of the studies have been discovered that the prevalence of halitosis of intraoral origin have been increased, so that the treatment should be cause-related, centered on reducing the bacterial load and microorganism by effective treatment. In general, treatment strategies can be applied by mechanical reduction of substrate and microorganism, chemical reduction of oral microbial load, it is considered as adjunct treatment to the mechanical treatment, rendering maladder's gases non-volatile, and masking the maladder. Mechanical reduction of substrate and microorganism. Mechanical reduction of intraoral microorganism can be done by tongue cleaning, tooth brushing, interdental cleaning, or provisional periodontal therapy. Many of the studies have been shown that tongue cleaning reduces both the amount of coating and the number of bacteria, and thus improve oral maladder effectively. These studies show that tongue cleaning reduces halitosis level in about 75% after 1 week. The cleaning of the tongue can be done either by normal toothbrush or by tongue scrubber. The cleaning of the tongue is best to be performed on the posterior part of the tongue as it has the most coating. Interdental cleaning and toothbrushing. The mean of the dental plaque control cause removal of the food debris and organism and thus prevent bacterial putrefaction. Also, the presence of periodontitis can cause chronic oral maladder. Provisional periodontal therapy is needed. This can be done by one-stage full mouth disinfection, combination of scaling, root planing with application of the chlorhexidine, thus cause reduction in the maladder up to 90%. Chemical reduction of oral microbial load. There are many forms of chemotherapeutic treatment that can be used as a part of a treatment adjunctive to the mechanical therapy. One of them, chlorhexidine. Chlorhexidine is an antiseptic agent which inhibits a wide spectrum of microbes, control plaque accumulation, and hence reduce halitosis. Its mode of action, by penetrating the cell membrane of oral bacteria, causing cell leakage and disruption of the bacterial metabolism, thus inhibiting the cell growth. The side effect of chlorhexidine cause abnormal taste sensation, and long-term use can result in reversible staining of the teeth and mucosal surface. Halite, a solution of 0.05-chlorhexidine, 0.05% CPC, and 0.14 zinc lactate without alcohol, have been more effective than chlorhexidine alone in reducing the volatile sulfur compound level. This may be explained by synergistic effect between chlorhexidine and CPC and chlorhexidine and the zinc. Listener rills. Listerine rinse was found to be very effective against oral malodor. It caused a persistent reduction in the level of the organoleptic bacteria and caused convert the volatile sulfur compound into non-volatile sulfur compound. Triclosan. Triclosan, which is present as a mouth rinse and also toothpaste, is another compound shown to have a broad spectrum effect on gram-negative bacteria. Its effect on both soft and hard tissue are known to last up to 12 hours from time of application. The anti-volatile sulfur compound effect of triclosan seems to depend on the solubility of the agent. Peppermint. The peppermint oil is one of the natural oils for the reduction of the body breath. Its strong mint taste neutralizes the odor, while its antiseptic properties kill germ and bacteria, and thus reduction of the bacteria putrefaction and reduce the body breath. Probiotic. Probiotic therapy are recently available. They provide a live microbial supplement that beneficially affects the host's healthy microbial balance. Several studies have shown that the use of probiotics, Streptococcus salivarian, for 3 days provide a marked reduction in the amount of bacteria that cause the body breath. Thus, the probiotic cause a balance of the oral flora and protecting the gum. However, more research needs to improve the effectiveness of the probiotic in the fighting of the body breath. Two-phase oil water rinse. The efficacy of oil water cetylpyridine chloride (CPC) is through the result from the adhesion of high proportion of oral microorganisms to the oil droplet that is further enhanced by the CPC. Twice daily rinse with this product provides reduction in the volatile sulfur compound and organoleptic rating. Hydrogen peroxide. The hydrogen peroxide effectiveness as antibacterial agent through the release of oxygen. Rinsing with 3% hydrogen peroxide show a reduction in the sulfur gases that persist for 8 hours. Zinc-containing mouth rinse. A zinc component of mouthwash have been shown to be effective in reduction of the halitosis by inhibiting the bacterial breakdown of the protein, thus reduce the bacterial sulfur compound production. Zinc is an ion which have a 2 positive charge that band with a 2 negatively loaded sulfur radical and thus reduce the expression of the volatile sulfur compound. Masking the malodor. Other masking agents like general rinsing product or chewing gum, flour toothpaste, mint tablet, and a variety of spray. All these agents provide a reduction in the oral malodor for a short period. The chewing gum helpful to reduce the oral malodor through both mechanical and chemical approach. The mechanical approach by stimulate the salivary flow. Some of the chewing gum that contain tea extract have a deodorizing mechanism. The main deodorizing agents are epigallocatechin. The chemical reaction between this agent and methylmercaptan results in a non-volatile product. Baking soda mouthwash is an easy method for making a homemade mouthwash. It can be made by mixing 1 cup of distilled water, 2 teaspoons of baking soda, 8 to 9 peppermint leaf, and 2 drops of tea-tree oil. All these ingredients are mixed together and provide a mouthwash. The baking soda have been shown to be effective in reduction of the oral malodor up to 3 hours. The mechanism by which the baking soda causes inhibition of the oral malodor is related to its bactericidal effect. How we can fight and prevent development of body breath. This can be done by changing the lifestyle, by brushing your teeth twice a daily, interdental cleaning, tongue cleaning, avoid smoking, alcohol, and regular visiting the dentist, or by eating food that fight the body breath, like drinking a lot of water, eating lemon, drinking green tea, and eating fruit and vegetables. As a conclusion, Halitosis is an offensive breath odor that has multiple sources and negative impact on the people's social interaction and quality of life. It is important for healthcare professionals, including general physicians and dental professionals, to understand its etiology and risk factor in order to provide accurate diagnosis and treatment. Reference. Thank you for your listening.